Hello and welcome to Talks on Law. I'm Joel Cohen. Today we're talking about the COVID-19 vaccine and the laws around it. We're getting the update from Professor Dorit Reiss of UC Hastings. Professor, welcome to Talks on Law.
Thank you for having me again.
We've seen that one of the first priorities in receiving the vaccine are medical workers, our first responders. We've also seen a couple of examples where doctors or nurses have chosen not to take the vaccine. Is there an obligation, or can doctors or hospital workers be fired for refusing to take the vaccine?
First of all, I would say that if you're working with vulnerable populations, there's probably an ethical obligation to protect them and your coworkers as much as possible from COVID-19, including by taking the vaccine. Legally, employers can mandate that healthcare workers take the vaccine. It's been done in other contexts, such as influenza. There are 4 caveats. First, these vaccines are authorized under an emergency use authorization, not under a regular license. And there's some legal uncertainty whether you can mandate a vaccine under an EUA. Right now, the Equal Employment Opportunity Commission has issued a guidance that suggests that, yes, you can mandate a vaccine under an EUA. And my reading of the statute is that there's a good chance that you can, but there's enough ambiguity that it can be tested in court, and I think there's a 50-50% chance which way the court will go. So one caveat is emergency use authorization. Second, if it's a unionized workforce, the collective bargaining agreement may require negotiating with the union before requiring vaccines.
Interesting. So it may be that you would have to negotiate with the airline workers union if you wanted to require that pilots and stewards and stewardesses take the vaccine.
Exactly right. And the third caveat is the American with Disabilities Act says that if someone has a disability, which will include a contraindication against the vaccine, they should be given reasonable accommodation unless it's a significant burden. Reasonable accommodation doesn't necessarily mean treating them like everyone else. It can mean requiring them to wear PPE, having them work isolated from the people who could take the vaccine. If there's a choice between remote work and on-campus work, they might be required to do the remote part, but they have to be accommodated unless it's a really significant burden on the employer. Finally, the Civil Rights Act of 1964 says that employers can't discriminate against employees with sincere religious objections to a workplace rule unless it's an undue burden. In this case, undue burden means no more than minimal costs. So there may be claims of religious objection to the vaccine by some employees, and you may have to accommodate them. Again, not necessarily let them work like everybody else, but give them some accommodation.
So it may be if you had a religious objection or a disability justification, you could be entitled to work from home or perhaps wear the right type of mask.
Exactly. But otherwise, yes, employers can impose a vaccine requirement. It's a health and safety rule. Those are allowed in the workplace. And they can fire people who don't comply with it. I'm not sure it's a good idea this early. This early, we have such a shortage. If workers don't want the vaccine, in most circumstances, it's probably better to just give it to someone who does want it. But there are exceptions. So imagine a long-term care facility with very elderly, very vulnerable patients where 30% of the workforce doesn't want the vaccine. It may be justified to require it from those people working with a vulnerable population.